She ran 5 miles every morning. She ate clean. She didn't smoke. She was 46 years old, and her last physical called her the picture of health. 3 months later, her doctor was telling her she had stage 3 cancer. And here's what's terrifying. Her story is not rare anymore. All over America, the runners, the yoga moms, the vegetable-loving dads, the marathon grandfathers are walking into doctors' offices and hearing words they never imagined would apply to them. So why is this happening? Why are the people who seem the safest from cancer being blindsided by it? And most importantly, could it already be quietly happening to you right now while you feel completely fine? Because cancer doesn't always announce itself. Sometimes it begins as a whisper, a strange fatigue you blame on stress, a small change in digestion, a bruise you don't remember getting. Tiny clues your body is sending that almost nobody picks up in time. Stay with me, because in the next few minutes I'll walk you through the silent changes happening inside the body long before diagnosis, the biggest mistakes even the most health-conscious adults are making, and the early warning signs doctors are begging Americans over 40 to stop ignoring. This could be the most important 6 minutes you spend on your health this year. To understand why healthy people get cancer, you have to understand something most of us were never taught. Cancer doesn't start the day you're diagnosed. It often starts 5, 10, even 15 years earlier. Deep inside your body, cells are dividing constantly. Most of the time, your immune system catches the mistakes and destroys damaged cells before they multiply. But every now and then, a single cell slips through. It mutates, it hides, and it begins to grow in silence. Here's where things become frightening. That growing cluster of abnormal cells doesn't cause pain. It doesn't trigger a fever. It hides behind a body that looks completely healthy on the outside. And what researchers discovered next shocked even seasoned oncologists. Modern life is quietly accelerating this hidden process. Chronic inflammation from ultra-processed foods, poor sleep, environmental chemicals, and constant stress can weaken the immune system's ability to detect those rogue cells. So even people who exercise and eat well can have a body silently struggling underneath. Most people never connect the dots. Persistent bloating, unexplained weight loss of just a few pounds, a cough that lingers, fatigue no sleep can fix, a mole that changed shape. Each one feels small, forgettable, but to a doctor, these whispers can mean everything. Mistake number 1, assuming healthy habits make you immune. Eating clean lowers your risk. It does not erase it. Feeling fit is not the same as being cancer-free. Mistake number 2, skipping screenings because you feel fine. Colon, breast, and prostate cancers develop silently. By the time you feel symptoms, the disease has often advanced. Mistake number 3, ignoring small, persistent changes. A cough that won't quit after 3 weeks. Blood where there shouldn't be any. Night sweats. Most people wait and Google. The survivors picked up the phone instead. Mistake number 4, trusting one normal blood test as a clean bill of health. Standard blood work was never designed to detect most cancers early. Many survivors say the same thing. My blood work looked fine. The encouraging truth is that most cancers caught early are highly treatable. Awareness is your most powerful tool. Start with the screenings for your age. Colonoscopies beginning at 45, mammograms as advised. Prostate discussions for men over 50, skin checks once a year. These appointments are quiet lifesavers. Build your plate around protection. Colorful vegetables, berries, leafy greens, beans, fatty fish, nuts, and olive oil feed an immune system better equipped to destroy damaged cells. Reduce ultra-processed foods, sugary drinks, processed meats, and excessive alcohol, all linked to higher cancer risk. Protect your sleep like your life depends on it, because it does. Deep sleep is when your body repairs DNA. Aim for 7 to 8 hours. Move every day. Walking 30 minutes is linked to meaningful reductions in several cancers. Manage chronic stress. It fuels the inflammation cancer loves, and know your family history. If a parent or sibling had cancer, tell your doctor. Most of all, listen to your body. If something feels off for more than 2 or 3 weeks, do not wait. Make the call. Healthy people are not invincible. They are simply better positioned if they stay alert. Your body whispers before it screams. The fatigue, the small change, the symptom you almost ignored. These are not interruptions to your life. They may be the very signals trying to protect it. The people who survive cancer are very often the ones who noticed something early and refused to wait. Be that person, for yourself, for the people who love you. If this video gave you something worth remembering, subscribe to Dr. Ethan Care, stay aware, stay screened, and never ignore the whisper.